Here, welcome to Udinese channel. So we were discussing 2018 Kerala Assistant Professor in Nursing exam question papers. We are continuing the same here. Let us see the question. Which of the following rhythm is considered as lethal dysrhythmia? And the options are idioventricular rhythm, junctional escape rhythm, premature atrial contraction, multifocal atrial tachycardia. The correct answer is idioventricular rhythm. It is a slow regular ventricular rhythm with a heart rate of less than 50 per minute, and there is absence of P waves, prolonged QRS interval, and it is also alternatively called as a slow ventricular tachycardia. It commonly presents in atrioventricular dissociation due to an advanced or complete heart block, or when AV junction failed to produce an escape rhythm after a sinus arrest or sinoatrial block. Let's go to the next question. Humidification of oxygen is recommended when oxygen flow is greater than, and the options are 4 liter per minute, 5 liter per minute, 6 liter per minute, 7 liter per minute. So the correct answer is 4 liter per minute. When oxygen is delivered at a flow rate of 1 to 4 liter per minute by mask or nasal bronchs, the oropharynx or the nasopharynx provides adequate humidification. So usually 1 to 4 liter oxygen is administered via nasal bronchs and more than 4 liters administered by mask. Let's see the next question. An antidysrhythmic drug that possesses some characteristics of all groups of antidysrhythmic drugs. The options are lidocaine, amiodarone, adenosine, procainamide. And the correct answer is amiodarone. Let us see the antidysrhythmics. Antidysrhythmics are classified into different types. The class 1A antidysrhythmic includes sodium channel blockers, so that has an intermediate association or dissociation and potassium channel blocking effect. The drugs include quinidine, procainamide, and can affect the QRS morphology, and it can prolong the QT interval. Class 1B antiarrhythmics include sodium channel blockers, which has a fast association or dissociation. The drugs include lidocaine and phenytoin. The overdose can prolong the QRS complex. Class 1C antidysrhythmics include sodium channel blockers with slow association or dissociation. The drugs include flecainamide or propafenone. Class 2 antidysrhythmics are beta blockers like propranolol, which is a non-selective beta 1 and beta 2 and has also some class 1 action. Esmolol, which is a beta 2 selective, and atenolol, that's also a beta 2 selective beta blocker. Class 3 dysrhythmics are potassium channel blockers like sotalol and amiodarone. Sotalol is a non-selective beta blocker that prolongs the QT interval. Amiodarone has class 1, 2 and 4 activity, and it also can prolong the QT interval. Class 4 antidysrhythmics are calcium channel blockers like diltiazem, verapamil. There are some other classes as in class 5 that for which the mechanism is unknown, maybe the direct nodal inhibition, and the drugs include magnesium sulfate and digoxin. So the next question is the mean arterial pressure to be maintained to maintain the perfusion of the spinal cord after spinal cord injury is. And the options are 75 to 80 millimeter mercury, 85 to 90 millimeter mercury, 90 to 95 millimeter mercury, 95 to 100 millimeter mercury. And the correct answer is 85 to 90 millimeter mercury. The current guidelines recommend maintenance of mean arterial pressure of 85 to 90 millimeter mercury for a first 7 days after spinal cord injury. Let us go to the next question. Which of the following is not a contraindication for nasotracheal intubation? And the options are mandibular fracture, frontal sinus fracture, basilar skull fracture, cribriform plate fracture. And the correct answer is mandibular fracture. Frontal sinus fracture can result in CSF leak and or intracranial infection like meningitis. Basilar skull fracture is an absolute contraindication for nasotracheal intubation, and cribriform plate fracture is a type of basilar skull fracture. Let us go to the next question. When was the first national health policy formulated? And the options are 1980, 1983, 1987, and 2002. And the correct answer is 1983. There were three national health policies formulated by the Government of India. The first national health policy was in 1983, which was followed by the second in 2002 and the third one in 2017. The goal of first national health policy in 1983 was access to primary care for everyone in India by the year 2000. Let's see the next question. World Immunization Week is observed every year during, and the options are last week of April, last week of June, last week of August, and last week of December. And the correct answer is last week of April. So there are some other days as well that we need to remember. World Breastfeeding Week is celebrated every year from August 1 to 7. International Midwives Day is on May 5th. Breast Cancer Awareness Month is celebrated in October. Lung Cancer Awareness Month is celebrated in November. World Antimicrobial Awareness Week is celebrated every year from 18 to 24 in November. Universal Health Coverage Day is celebrated on 12 December. Let's see the next question. Name of the mission launched by the Ministry of Health and Family Welfare with the aim of expanding immunization coverage in 2014. The options are Mission Rainbow, Mission Bhagiratha, Mission Prahar, Mission Indradhanush. And the correct answer is Mission Indradhanush. The Ministry of Health and Family Welfare, Government of India, launched Mission Indradhanush in December 2014. It is a special drive to vaccinate all unvaccinated and partially vaccinated children under Universal Immunization Program. Let's see the next question. What numerator is used in computing general fertility rate? And the options are estimated mid-year population, number of pregnancies in the year, number of registered live births, number of females of reproductive age. And the correct answer is number of registered live births. So the general fertility rate avoids some of the deficiencies of crude birth rate by changing the denominator from total population to the number of women in the reproductive age group, usually 15 to 49 years. General fertility rate is a ratio of total yearly registered live births to the female population of childbearing age, 15 to 49 years. So the formula can be written as general fertility rate is equal to number of total registered live birth of residents in a community in a population divided by the total female population aged 15 to 49 into 1000. Let's see the next question. Unused BCG should be discarded how many hours after reconstitution? The options are 2 hours, 6 hours, 4 hours at the end of the day. And the correct answer is 6 hours. So the Indian Academy of Pediatrics Guidebook on Immunization stipulates that reconstituted BCG should be used up within 4 hours or a maximum of 6 hours. So these are the questions for today. We will see with a new set of questions in the next episode. So if you like the channel, please like and subscribe so that you will get the updated videos and notification when new videos are being uploaded. Thank you.